Okay, then I'm talking to you about our testosterone replacement protocol and how we think why we think it's so much better than a lot of what you're seeing out in the marketplace. We've been in business for 10 years, almost 10 years, and we've been doing testosterone replacement therapy since day one. I've personally been on therapy for about 12 years. So we've seen thousands of patients. Even though we're primary care, we're also we're pro TRT because we know how much of a difference it makes in men's lives. We see it every time a new patient comes in. We see the difference between what he was when he first started, and 5 or 6 weeks later, he's a whole new person, and it's awesome to see it. But just real quick, and then I'll go into the details. What makes us different? 1 is how we monitor your health for safety. 2 is we don't use any compounded medication, so you have more consistent results. And 3, we are always looking for ways to save the patient money. So you're going to find that we're typically 50 to 60, 70% less than most of in the marketplace out there. And you know there's TRT clinics everywhere now. They're popping up everywhere. Seems like everybody's doing it. So this is what makes us different. First, let me talk about monitoring your health. It's very important that you monitor your health because there can be some serious side effects if you have those side effects, like watching high blood pressure, watching PSA, watching hematocrit, hemoglobin. So you have to do blood draws, or drain blood, pull off, phlebotomies. So I don't know why I couldn't come up with that, but just pulling blood off every so often to keep your hematocrit and hemoglobin down, your blood cell count down. So the only way to watch those, you have to be monitored properly. The only way to do that is to be able to do blood work. Now, a lot of clinics out there, in the beginning, when they have a new patient, in order to establish your dose, they'll do blood work every 3 months, and then once they establish your dose, it's every 6 months. Well, we don't like that. And some patients are even a year. We've seen it many, many times where they hadn't done blood work in a year, which is extremely dangerous and asinine, in my opinion. And so what we do is in the beginning, we're going to do your blood work every 6 weeks. So the reason we do that is because we know that you're going to have a complete saturation of the testosterone in your blood system within 4 or 5 weeks. So whatever dose it is, we know this can be maxed out within 4 or 5 weeks. You're going to feel the maximum effects from it. And we're going to do blood work again and talk to you about your symptoms. Are you having symptoms, things like that. Well, if you're having symptoms and we do your blood work and it still comes back a little low, we're going to come back and we're going to raise your dose. And then we're going to do your blood work again in 6 weeks. Well, if we didn't do blood work for every 3 months, what's going to happen? Well, you're going to feel like crap for the next 3 months because your dose is still too low. It didn't make enough, it didn't raise your testosterone levels enough to get to that level that you needed to be at where the symptoms disappeared. So that's why we do this lab so often in the beginning, is because we need to establish our dose so you feel the best you can as soon as possible. And then once we establish your dose, then we're going to do your lab work at maximum every 3 months. Maximum. If we get to the point where you need to do blood work in 3 months and for some reason you can't get it done, well, you don't get your next prescription until it gets done. We're going to watch your health closely. So we monitor you very closely. We're very vigilant. And even in some cases, if you're one of those that may have one of the side effects, we're going to do your blood work even more often. Or if you feel a change or you have a life event change, that's why we talk to you every single month. Before we write your prescription, we're going to talk to you to make sure, say, how's your blood pressure. Now, how we do that is, I'm kind of getting ahead of myself, but we'll also send certain equipment that you're going to need so we can monitor your blood pressure, we can monitor your pulse, your oxygen levels, things like that, so that we can monitor you properly as you continue down the road with the TRT protocol. So in the beginning, when we first set you up, we're going to do all your lab work, do the consult, and we're also going to send you the equipment that we need to monitor you. And it's a variety of equipment. So all this is going to be included in the very beginning so that we can monitor your health properly. I don't know of anybody who does that. So I'm not saying they don't, but it's pretty rare that they're going to be watching your blood pressure and your heart rate and oxygen levels, things like that. So we're going to watch you very closely. You can feel very safe. So that's the big difference, is we monitor your health so closely because we're primary care. So we're watching your total health, not just your testosterone levels. The next big difference is we use name brand products. Whether it's here in the clinic or we write a prescription for you, it's going to be a product that's not compounded. We don't use compounded products. And the reason for that is certain medications you can compound any medication. But certain medications, they have to be so precise for them to work that the compounded or even generics don't work. So testosterone is not that precise, but it can, depending on the quality, you see a pretty big variance. When it comes to a compound medication, you have to change the formula slightly in order not to infringe upon the patent. So they also allow a variance in order to be considered that same medication, 20% high or low of the original formula to be considered that medication. So there can be a wide variance. And what we've seen a lot with compounded testosterone is they'll have a yo-yo effect, because depending on when they bought that batch or who they bought it from, it has a different strength. So sometimes they feel great and sometimes they feel bad because the testosterone is not as strong and they get their symptoms back. Well, that sucks, because you don't want to be inconsistent. You want to be able to get consistent results. Also, as a healthcare provider, we want to be able to make adjustments knowing that the medication itself is consistent. It's you that's changing. So if you have compounded medications, you don't know, is it the person or is it the medication for those changes? So we don't use any compounded medications for our testosterone replacement therapy. Now, we do use compounded medications for other things like peptides and weight loss, where it didn't have to be as precise. But when it comes to TRT, we don't. Another big difference between us and the other clinics is we can accept insurance. You have to qualify for it, which means you typically will have to do 2 blood draws. This is if you're brand new to it. You have to do 2 blood draws, or lab work, on 2 different days, early in the morning, and your levels have to fall below the minimum requirement based on the lab company, which for LabCorp I think is 248. So if you do 2 blood draws and your blood work is below 248, you will qualify and insurance will cover it. And that can save you a lot of money, possibly. Depends on your insurance and your deductible and copay. So if you have insurance, the insurance will cover it. It can be almost nothing or actually free for you. But if you don't have insurance, we have low cash pay prices. And we're always doing everything we can to help you save money. I mean, we're actually always looking for ways to save money. So for example, you'll typically save 50 to up to 70% compared to what you're going to see out in the marketplace with us versus them. And the reason is we will charge for a consult once a month, and we will write a prescription for the medication that you'll pick up at your local pharmacy. Where a lot of clinics will, what they do, they bundle it. And there's some products you have to. I understand why they do it, it's a business, but I'm just telling you how we do it. And we do it this way to save you money. And when they bundle, they have to use compounded medications. And what they'll do is they will, like we said earlier, the compounded medication is a lot cheaper. So they'll bundle it for, $200 to $400 and send you the medication every month, and then it kind of includes everything. Well, it ends up costing more money. Where with us, on a monthly basis, once you get your established, you're looking at roughly, including the medication, maybe 100, 110, maybe 120, depends on the medication in your area. Because if you use a Good RX coupon, for example, here in Tennessee, at the local Kroger this morning, it was $19.78 for 4 200 milligram vials, which is a month's supply. So you get a month's supply of testosterone for under $20, and that's cash pay. If you have insurance, they may cover it. So we're going to end up being a lot cheaper, roughly 120 maybe a month or less, compared to several $100s a month. So we're always looking for ways to save you money, and not saying that other companies are taking advantage of you, but we're just doing the best we can to keep the price as low as we can for you so that more patients can afford it. So the big difference is we watch your health, we watch your total health, and we monitor you so much more closely. 3, we don't use any compounded products. And 4, so you have the consistent results. And 4, we always are looking for ways to help you save money. And we're always going to be available. I was actually doing a test the other day, just calling the competitors, see how they were, and it took 48 hours for it to get a call back. Well, with us, we always kind of stay slightly overstaffed. So when you call in, you should get a pickup immediately, and we will get you scheduled for a telehealth visit or get you scheduled in person quickly. And most of the time, it can be within a couple hours. So it just depends on our schedule, because we also do walk-ins as well. So we're going to take good care of you. We're going to be available when you need us, and we're hopefully going to end up saving you a little bit of money in the long run. So If you have any questions about it, feel free to give us a call. If you're new to it, we'll be glad to sit down and explain it to you. If you're switching over from another clinic, just give us a call. We'll talk to you in detail about your current situation, any symptoms that you're having, dosages, things like that. And we'll be more than glad to help you in any way we can.